Good morning, my name is Alicja Bożek and I'm a business solution consultant at Komar Healthcare. Every day I work at Komar headquarters located in Krakow, Poland. I have pleasure to work with foreign teams and I will lead today's webinar for you with some representatives of the teams. There will be Ella MA from Komar Benelux, Simone Agazzi from Komar Italy and last but not least Bartosz Tararo from Komar Japan. I cordially invite you to the webinar entitled Telemedicine is here to stay, the importance of telehealth during Covid-19 pandemic. At this point you can see the agenda of today's webinar. The following topics will be brought up. At first, Komar introduction, then telemedicine before, during and after Covid-19. The next point will be Komar healthcare portfolio. There will be about solutions that ensure continuity of medical care while lockdown and contact restriction. Then I will give the floor to my colleagues from Komar Italy, Komar Benelux and Komar Japan, who will tell you about situation during a pandemic in each country. Before we start, I would like to introduce you to Komar briefly. The company was founded in 1993 by Professor of AGH, University of Science and Technology, Janusz Filipiak and his 12 students. The company began to grow very quickly and today Komar is one of the largest Polish IT companies. Now on the slide you can see several Komar locations in the largest Polish cities. The head office is located in Kraków, from where I have pleasure to lead this webinar. There are also many worldwide offices. Let's have a look how the company presents itself on a global basis. Komar has a total of about 90 offices in 34 countries on 5 continents. Every day in 66 cities around the world, Komar employees face challenges and build the IT world. The company allocates significant financial reserves to research and development activities, resulting in the production of innovative solutions that meet our clients' needs. As you can see on the screen, the funds allocated for this purpose are larger from year to year, and in 2018 they reached a record increase. It is worth emphasizing that this is a very important element of the Komar Group policy. Komar consists of 7 separate business units. Now you can see the 7 branches that make up the Komar Group. It should be mentioned that these business units were not created at once. Along with the development of the Komar, based on the experience of previous, new one has been created. Today we will focus on the Komar healthcare sector and its activities, which is, as one can say, includes an extensive ecosystem of solutions for health. It consists of EHR cloud, telemedicine cloud, hospital cloud and medical AI cloud. As one of the few companies, we have our own medical center, iMed24. It was created in 2012. It is worth mentioning that Apple and Amazon have decided to such a move only in 2018. The primary goal of the iMed24 medical center is to provide comprehensive outpatient medical care. Our own medical center is an added value during the process of creating software for healthcare. The experienced staff have a key role at the last stage of testing and provides the most crucial feedback. iMed obviously also uses telemedicine, which is one of the areas that Komar focuses on. Let's talk about telemedicine. Telemedicine is a part of broadly understood e-health, which is defined in over 50 ways, according to an article published by representatives of the University Health Network and the University of Toronto. The easiest way to describe telemedicine is by providing remote medical services. The patient can be distant up to thousands of kilometers from a medical facility and constantly use the service they offer. This is how telemedicine works. The patient is at home, a place where he feels comfortable and safe. He has appropriate equipment and technologies that allow him to perform tests without leaving home. The term telemedicine can cover many types of remote services, including performing tests, monitoring vital function, consulting a doctor, and many others. This is especially important if we are talking about pandemic situation. At the time, many medical facilities do not function normally. It It is recommended to limit visits if are not urgent. Various restrictions and recommendations to avoid public places. In this case, telemedicine can be very helpful. It enables continuity of treatment, contact with medical personnel without leaving home. This can be particularly important in the case of elderly or chronically ill people. Recently, we have significant progress in the popularity of telemedicine. We are flooded with the information about new solutions that's supposed to help people during quarantine. They increase access to medical care and information. One could say that telemedicine finally gets the attention it deserves. The world began to see its potential. But it wasn't always that way. Telemedicine was skeptically perceived by patients and medical professionals. The coronavirus has made people feel the need to use remote medical care. Pandemic has accelerated some processes, not only in terms of technology development, but also the way people feel about it. The question is what the patients and physicians gonna do when the choice fully come back. Will everything return to pre-pandemic times? Or maybe Covid-19 has changed healthcare forever? Only time will tell, but Covid-19 has certainly proved to be a catalyst for progress, technological progress, development, and our approach to technology in various areas of life, and particularly in telemedicine. In the Comar headquarters, there is Comar Innovation Space, where I am right now. This is a place where products from all Comar business units are presented. Clients and all interested are invited here because we care about popularize new technologies. Visitors have the opportunity to literally touch and test the possibilities offered. They get to know the real cases in which the solutions works. It is very important when creating technology to meet its potential recipients of different ages. Their questions, reactions are priceless. People and their needs are the driving force in the technology development. In Comar Innovation Space, the eHealth Zone presents many telemedicine solutions. Visitors have the opportunity to find out what is happening at the different stages in remote care. I will also try to show you the way it works. Comar offers includes solutions addressed to various groups of end users. The heart of remote care is the Remote Medical Care Center and the eCare platform. The platform is a tool in hands of medical personnel. It can be said with full conviction that the eCare platform supports medical and intervention staff in managing work and follow the procedures. Telemonitoring is possible thanks to the integration between the platform and devices. The platform allows receiving notifications from devices and managing the data, as well as contact with patients' emergency. What solutions communicate with the eCare platform? Comar Diagnostic Point consists of IT infrastructure, a tablet, which is a communication device, as well as integrated measuring devices. They allow verification of patients' basic life parameters. But how does it work? At the beginning, the user fills out a survey in the case of physical activity, cigarette and alcohol addiction. Depending on the answers given, she or he can join a more detailed form of survey. After completing them, the test begins. Software is intuitive and guides the patient step by step through the whole process. That means that it can be performed by the user independently. Comar Diagnostic Point can operate in two modes. The basic one with the devices like blood pressure monitor, ECG event recorder, thermometer, pulse oximeter and scale, or in the extended mode, where apart from the mentioned devices, glucometer, stethoscope, otoscope or lung monitor are accessible. However, it is recommended to support by medical staff when carrying out extended tests. Diagnostic Point is available not only in two modes, but also in two versions, stationary and mobile. This is how the mobile version looks like. In this dedicated suitcase that allows easily move to the different places. And now the stationary one. The stationary version is can be located, for example, in offices, medical facilities, hotels or headquarters. always in the same place, so you can check your health status wherever you want. The mobile version is dedicated to places where there are infrastructural limitations, such as cruise ships, aircraft decks, trains, or when patients have problems with moving, including nursing homes. During coronavirus pandemic, diagnostic points can be kind of checkpoint. Using a dedicated thermometer with Bluetooth low energy technology, the user can measure body temperature and a moment later the results displayed on the screen. We will also find out if the results are correct or incorrect. Due to the flexibility of the solutions, it is possible to expand the system with the functionality of a pre-qualification survey of coronavirus infection. At the diagnostic point, it is also possible to carry out video consultations with a specialist. During such remote consultations, we are able to perform tests using available devices. The results goes to the eCare platform so that the doctor has immediate access to the outcome and can give patient medical advice. What happens at the end of the examination at diagnostic point? The patient received a report via email. It can be a basic report containing only the results or the extended report containing descriptions and recommendations. If the user of the diagnostic point is also a user of Comar and Health Note application, the test report can be directed straight to the application. What exactly is Health Note? Comar Health Note app, also known as Internet Health Diary, allows to enter measurement values such as glycemia, blood pressure, pulse, weight or temperature in a simple and quick way. Users can add daily measurements. They can also see the chart on the data they entered in each day. It is possible to compare wherever their health has improved, deteriorated or remained stable. The application is as easy to use as possible. One of the problems reported by physicians is when the patient has difficulty describing their symptoms. They are not able to report the frequency of each symptom. In Health Note, it is possible to mark them anytime. Health Note allows to collect and store medical records. Users can enter also traditional paper documentation by scanning it. Such a document is described, tagged by the user, and it comes down to choose a type of document. Then it is easier to search and group them. When visiting a physician, the patient can share documentation. Doctor account is not required. Patient only need to scan QR code on the Health Note website and select which data he wants to share. Then physician have access to the patient's data. In Health Note, there is also coronavirus feature, what means that the user can complete the survey to verify wherever there is a risk that he has become infected with coronavirus. Based on the answers, information about the type of the risk is displayed on the screen. Of course, the survey is not the way to confirm the presence of the virus, but it shows the risk of infection. We also do not forget about the elderly people who are particularly endangered during COVID-19, as we learn from various sources. One of the main recommendations addressed to seniors is stay-at-home orders. It may deepen the feelings of loneliness or helplessness. The Life Bracelet definitely increases the sense of security. The main functionality of the device is Red SOS button. Patients may use it in life-threatening situations or serious health hazards. Thanks to the eCare platform, the paramedic received notification about contact request. According to the procedure, they give bracelet users appropriate instructions. Sometimes patient calls and reports, for example, chest pain. Paramedics have access to the patient's medical history and implement appropriate procedures. Based on the information and knowledge, they decide what to do. They give recommendation, and if it's necessary, they call an ambulance. The Life Bracelet allows to locate the patient by the GPS, BTS or home location. This is important especially when paramedics call an ambulance. Seniors can also use the yellow button, so they get support in situations that are not as urgent as mentioned a moment ago. Using an e-care platform, it is also possible to define geographical boundaries thanks to geofencing feature. The Live bracelet is very easy to use. Even in emergency situations, users are able to press the SOS button and contact the monitoring center. The Live band is on the wrist, always nearby. The CareMate application is an additional service offered together with the Live bracelet. It is an app in which a caregiver or a family member can monitor the patients and the elderly people activity. Caregiver is viewing the exact senior location and, for example, heart rate. He can share accounts for other caregivers, which means that several people can look after one senior. Also, checking the charge level of the device and making a phone calls to the senior is possible. Comarch telemedicine offer is really impressive. In addition to the solutions described earlier, there are also products directed to cardiological patients, such as Comarch CardioWest or Comarch CardioNow. The first solution allows for long-term patient monitoring in a home environment. Patient wears a dedicated vest and specialists have the ability to monitor his heart up to 30 days. The solution allows detecting abnormalities in the work of the heart, which the standard 24-hour Holter examination may not detect. The aforementioned Comarch CardioNow is a kind of telemedical Holter. The telemedical function gives the possibility to send a signal recorded to the remote care center in a case of emergency. The medical staff can quickly analyze it and take appropriate action. Both of these cardiological solutions are supported by artificial intelligence algorithms that automatically detect disorders and send the information to the remote medical care center. The use of AI makes the solutions innovative and improves the work of medical staff by analyzing large amounts of data. The last solution I would like to mention is Comarch Home Health. It is addressed to various groups of patients struggling with various health problems, including these with chronic illnesses. The elements that make up the solution is a tablet or a mobile phone with dedicated software. It can be integrated with various medical and diagnostic devices. It allows to perform daily tests such as blood sugar, blood pressure, temperature, etc. The results are displayed on the screen right after the test and sent to the e-care platform. Patients using the solution do not have to remember when to perform each kind of test or which drug they should take. It is all configurable on the cloud platform and the patient receives reminders. Of course, it is also possible to perform measurements anytime, not only at the predetermined time. Patients also have the opportunity to complete various surveys. The solution therefore allows for personalization of treatment. Telemedicine market is becoming increasingly attractive. As we can see, it helps to reduce hospital visits and cross-contamination. It helps people stay healthy indoors. Accordingly to observations of IMED24 specialists, as the result of social isolation, remote work, limited contacts, fewer cases of infections as flu and cold has appeared. This is a valuable observation and probably argues for the use of telemedicine as a significant equivalent element of medical care, not just its separate branch. Thank you very much for attention. Now it's time for the next speakers. Best wishes and stay healthy.
Hello everyone, I'm Simone Agazzi, Healthcare Sales Director of Comarch Italia. Welcome to today's webinar. I thank you for your participation and I hope to share our experience in this area with you, both now and after with dedicated meetings in order to compare our countries and exchange our experience. Keeping in mind the trend of increasing seniority that will be explored a little bit later, we can say that innovative services are needed to place the citizen or the patient or the guest, depending on where we want to see him, at the center, in order to provide to him a well-being and healthy life. It is also important to innovate the activity of the operator who daily dedicate their lives to help fragile people. So now I would like to focus on my territory, so on Italy, by analyzing my population and our countries. So ISTAT data tell us that almost the 40% of the people is affected from chronic disease. And if we find over these 40%, almost the 20% has at least 2 chronic pathologies, so they have comorbidities. So what is the structural capacity of the national health system in order to manage this disease? But above all, what are the models to consider in order to avoid acute illness and reduce the hospitalization number, and also to reduce the duration of the hospitalization in the hospital? Well, if we also look at this important data that is really important, we can check that this is the number of in days of access to some hospital services. We can clearly see that the length of access to these services are really long, and this can cause discomfort to the citizen, but also to provide the idea that the public system is not successful, or maybe they have so long path that the people is starting to use the out-of-pocket regime, so to start to use private hospitals. Of course, now private hospital is checked also and perceived as a better service, not only because they have maybe the single access or the single service with a higher quality, but also as a whole, you know, starting from the booking services to the end phase of the diagnosis and care. So COVID has greatly expanded this problem, and now with the public system is really difficult to access some standard service in order of the very long list and waiting list. So now the private sector is trying to increase the possibility in order to organize themselves better and to expand the possible offer. So moving on to a more specific example, for example, I take the hypertension as a model, the most common chronic pathology among the Italian people. And the number, the 864 euro, represent how much cost an hypertensive patient per year. And we can say that this type of patient absorb more than the 50% of all specialistic visit and diagnostic tests carried out by the national health system. These are really important numbers that make us thinking on the type of assistance that can be provided, and above all, on the fact that with the same investment in healthcare, the increase in chronic people will increase the trend even more. Basically, if the investment in the national health system would remain the same, the increasing number of chronic people and the increasing number of senior people will create some problem on the care in Italy. So how can we improve by innovating the service and expanding the catchment area while keeping the hospital uncrowded in this case? Well, telemedicine and teleconsultation allow to provide the same service, obviously when it's possible, because not always is possible to provide a televisit, of course, if there is a diagnosis behind. But we want to maintain a very high level of quality, allowing universality of care and universality of access to the performance inside the territorial level. So all the people in all the region must have the same possibility to have the same care in all Italy. In addition, telemedicine also allow the attention to be focused on the daily basis and on focus on the single patient in the context, for example, for the chronic disease. So providing a daily basis check and checking and verifying, for example, the adherence to the compliance, and creating a more dedicated therapy daily basis. Digital health, so, is not new, but now is necessary. We should not speak of a digital revolution, but simply of an evolution of the service where digital is an enabling service. So now let's focus on healthcare and COVID now in Italy. So if we check the COVID impact that have in the Italian territory, we can see that is huge. Difficult accessing the structure. So think about the people that do not have the possibility to enter in the hospital or to enter in some clinics because of the problem of the lockdown, and also because of the problem of the very, very long waiting list. Now also there is the problem of the citizen that is going out from the lockdown. In this case, the people that has to restart a normal living, a normal life, then they could have possible problem in psychology, in problem of going outside and having fear of the COVID. There is a huge lack of doctors and nurses now. Now it's going a little bit better after the lockdown, but during the lockdown there was a huge missing part of doctors and nurses. There is also important territorial barrier now. Think about just also before the pandemic, also before the COVID, there was this problem in Italy, but now it's even more, because before the territorial barrier was, for example, starting from the north of Italy to the south of Italy, but now it's different. Now the problem is also between the same city of the people that cannot go to the hospital because maybe there is some restriction, and this restriction increased the waiting list. There is actually a total absence of the traditional health visit. Now, actually, it's going a little bit better, as said before, but there was a total absence of this traditional health visit, but there was only emergency one. So in this graph also, I present another important and actually worrying trend. This is the list of the essential services denied by the national health system because of lack of resources or for a matter of costs. You can see that the data are up to date to the 2019, and the trend was worsening year by year even before the COVID, and this means that in 2020 the situation it will be worse and the percentage will be higher. So basically, the essential level of care is denied by more than 50% over the year. So when we talk about denied healthcare, we are not only discussing about a matter of equity, which is one of the pillars, of course, of the Italian national health system, but also we spoke about the concrete effect of the crisis, of the COVID crisis. What is crisis is representing in this chart is, for example, showing the various waves. So the first wave in terms of outcome due to the crisis is clear, you know, it's linked to the virus itself. But what about next? The second wave and the third wave, for example, will be, for example, impacted on the restriction of a huge non-COVID condition. So the problem of not having a doctor or accessible hospital. After, there will be also the problem in the second wave, for example, that can be dedicated to the psychology trauma, mortal illness, economical problem, and burnout of the people due to the problem of this stress, you know. So COVID will have a huge impact over the next year, and we have to find a way to help these people to live a well-being life and to live healthy. So this is the problem, and this is why healthcare needs to be adapted somehow and to change the trend before, since before the pandemic. So in Italy, the word healthcare has always been associated to the concept of hospital. But demography and chronic people are teaching us a new lesson. More resources has to be dedicated to fight for a broad spectrum of diseases and actually to change the thinking between the hospital to the territory, so for going in the direction of the home care. The need is not something new, so it's not something new due to the COVID. It was starting to be also the previous years, but it has been consolidated during the COVID, and the problem is how to do it. So when there is a problem of how to do it, there is an opportunity here. So new models are under evaluation with significant difference among the Italian regions, of course, because Italian healthcare system is regional, and the technology is a strong enabler. So just to spend a few words about the organization of the territorial health has been different, for example, among the region. You can observe how Lombardia on the left has followed an approach focused more on hospital treatment, while Veneto, since the beginning, discouraged this kind of behavior, counting more on a home care. The results between the region have somehow created different outcome, and this is not the case. So in Veneto, the trend is better and more linear. So the previous analysis has been a trigger for the region in order to start aligning their regulation with the needs. For example, in this way, the Tuscany decided to formally introduce a reimbursed central system for teleconsultation, for example, while Veneto equalized the telemedicine system, also included both remote monitoring and televisit, to the traditional medicine. These are strong signals about the healthcare system changing approach, and it's reasonable to think that more ventures are about to come. So which are the pillars above which introduce innovation in this sense? I try to summarize the most important one now. So the first one is the patient-centric approach. Of course, innovation needs to meet the user requirement, of course, but in different direction, because they are the endpoint, they are the final point of the telemedicine. But having the patient at the center allow the next generation hospital to provide to the people a huge impact. They are responsible for themselves. Territory, for example, the territory and the follow-up are for sure connected. Overcome limitation among the citizens is a duty for a national healthcare system, and caring about them is, in this moment, is really important. Going into the territory is fundamental to allow to have uncrowded hospital. Reimbursement is another pillar. So in a system, in a healthcare system where the telemedicine is equalized to the normal medicine, we can create really a new innovative way and new model of taking care of the patient. Scalability, of course, is another pillar, because all the patient has to have a universality of access to the care, also to the digital care, and this is the reason why scalability is one of the pillars. And the last one is the patient experience. So the patient has to have the best experience in order to have a daily basis connection with the hospital or the national health system of the territory, and creating for them the best way to have a better life. So now I would like to speak a little bit about the Italian customers, and we have different type of customers. We have Over, and with Over we are doing a very good home care service using wearable. Centro Cardiologico Monzino is one of the most important cardiology hospital in Europe, and they are using our product to create telecardiology. With Medicare, we are doing home care services and using our e-care platform, providing telemedicine at home, reading people, and checking the health status of the people also in ventilation. We have been partnered with Wintre of the Road to 5G project, and in this case here we tested our telemedicine solution using the 5G technology with very, very good results. With Fastweb we have created project in telemedicine also with them. Fastweb is another Italian telco, And with the last one, Malvestio, we are creating a very innovative smart bed. So we created asset tracking on the hospital bed and innovation really on the bed of the hospital. So now I would like to be a little bit more practical and to focus on the product that Comarch is providing in Italy and how we are approaching that. We have two different type of part for the next generation hospital that we are promoting in Italy. You know, one of the part is the remote care and the other part is the video consultation. These are the two sides of the same coin of the telemedicine. Let's start with the remote care. So in the remote care, I would like to check some key principles. So first of all, who is the user? Of course, fragile people, but also COVID people, COVID-infected people, and a patient that has to create follow-up or therapies as outcome after, I don't know, for example, some surgery or so on. Why they should be monitored at home or remotely? Of course, to have a better outcomes and taking care of the patient daily basis. So monitoring parameters once per day is pretty different than letting them worse day by day without knowing anything. How a solution should answer these needs? It has to be simple for the end user, and it needs to be smart and reduce the some useless operation that usually the clinical operator is doing. So they have to be enabler on the new digital way of thinking for healthcare. Has to be smart. Talking about the ecosystem of Comarch, I would like to show in this slide our product. So we think about our remote care solution in a holistic way. So we want to be a good technology provider for the healthcare providers in order to provide various verticals of the healthcare, starting from the home care, for example, for chronic people, chronic disease and third age, but also for ventilation, for telecardiology, but also providing solution for the territorial assistance like the Comarch diagnostic point, providing this point for the auto check of the people directly by themselves, but also providing wearable for the people that they are able to check themselves, but without doing anything, because the wearable is able to provide some information to a remote care center. Of course, every one of these vertical has to be supported by a platform that is the Comarch eCare platform, with a lot of algorithmic that is enabling and exchanging and transforming the data we are receiving into interesting and very, very productive information. So the eCare platform is a medical device class 2A platform that we are promoting, and our create is web-based, so we can access this platform everywhere. We have a sort of remote center part where we can have an alert system, possibility of doing video consultation, surveys, remote monitoring, checking of the adherence to the compliance, to the therapeutic adherence, checking the parameter of life of the people that they are taking care of themselves using our home health solution that I will explain, and various medical products. So if we speak about our home health solution is a tablet with installed our own certified application. And here we are able to check different type of devices, different type of devices in Bluetooth. They can be connected to our platform. And simply with a wizard, we are helping the people on taking the measurement and after remoting the measurement to the cloud, to the eCare platform. There is also some other possibility to creating telefunctionality, for example, being in contact, in video consultation, being in contact with a remote center, sending diagnostic results, checking remote application, for example, receiving reminder, self-interview, rehabilitation. This is the Live wristband. Live wristband is the wearable we are using in Italy with our project. Approximately, we will have more than 5,000 bracelets active in our country. Here we are able to monitor the heart rate. We are able to check the GPS position of the patient, so help them if they lost themselves in mobility. There is the possibility to create connection, call connection between the wearable and the remote care center. Think about how many services we can enable providing a daily activity with the citizen in Italy, with senior people. This is an enabler for the silver economy. So I would like to end and to conclude with the teleconsultation. Teleconsultation in Italy now is becoming really important. Must be easy to use, must be secure, GDPR compliant, must be integrable with the already present hospital systems, but must be scalable, not only for us, for Comarch in providing more and more solution concierge to a lot of hospital, but also for the hospital. Think about the possibility also for the doctor to do smart working. Doctor at home that is able to create and to do televisit with patient directly from their home. We can create a very huge scalability for the doctor and create a huge ecosystem. So basically, with the Common Concierge, that is a cloud solution, we are able to centralize the management of the operator. The operator is able to check, to create, to make reservation, but also the patient is able to create reservation and to buy the single visit directly into the cloud. In this case, the doctor will only has to exchange information and exchange the document with the patient and see in a video consultation and after create the final review. It's easy, very easy to use, and a huge amount of visit can be transformed into video consultation. So I would like to thank you, grazie, for your participation. And my name is Simone Gazzi. Here there is my contact if you need to contact me. And now, thank you very much, everyone, and have a good day.
Hello, everybody. This is the Brussels office speaking. My name is Ella Ameye, and 3 months ago, Quentin de Raad and I kicked off the Comarch Healthcare adventure in the Benelux. I am responsible for business development in Belgium and Luxembourg, and Quentin de Raad is our sales director for the entire Benelux. And although our team is still under construction, let's say, and we entered the market only a few months ago, I am happy to give you an overview of some trends and our activities in the Benelux market. Let's first start with giving you some context. Actually, the Benelux healthcare landscape is mainly publicly organized, which results in a complex stakeholder landscape. And you might think, yeah, a complex stakeholder landscape, that's the case everywhere in the world for healthcare. But if you're aware of the fun facts that, for example, in Belgium, after 6 reforms of the state, we now have 9 ministers of health, each responsible for their own business, then you know I'm not exaggerating when I say we have a complex stakeholder landscape. That's not the only thing. With its 29.2 million inhabitants, the Benelux is a densely populated region. Moreover, it's important to mention that more than 19% of the population are 65 or older. And this aging population, it has consequences. On the one hand, there's a very high demand for a place in a nursing home. And on the other hand, there's a clear will for people to be able to stay at home longer with some assistance. This definitely influences our business and our decisions. It is also the aging population that is partially an explanation for the ever-increasing healthcare spendings in the Benelux. The Benelux countries are all definitely big spenders. Few European countries are spending more than we do. It also means that the financial model is under pressure, the margins are getting squeezed, and providers are adapting to that, to a changing environment. They come up with new strategies, including consolidations, changing service delivery models, and coordinating care along value-based networks to try to better capture the revenues across the continuum. With this context in mind, we chose in the Benelux to focus on remote care. And how we define it is actually remote care that's services that support diagnostics, that complement therapy, and that increase the effectiveness of patient treatment and safety. We're talking about services of proven medical value, facilitating the communication between patients and physicians. The core of all of this, of course, is our e-care platform. It's really the spine or the beating heart of our telemedicine portfolio, and it allows to combine all the solutions into one convenient point of patient management. The solutions that we decided to put forward in the Benelux are, first of all, the diagnostic point. It's a great product. It allows care institutions to expand their medical capabilities in Belgium and in the Benelux by extension. There's often a lack of doctors, and that can be countered by sending paramedic staff on the field, supported with the mobile diagnostic point and connecting it to a doctor who stays on site. Secondly, the life wristband. This is, of course, with the aging population in mind. In the first place, these people want to stay at home as long as possible, and the wristband allows them to do so, and their loved ones can keep an eye on them and on their health. Then the third thing is the home health. The telemonitoring of patients has proven to work. It can save hospital beds, it can avoid readmissions, and we clearly notice that Benelux hospitals are experimenting with telemonitoring programs, and we are here to support them with our home health system. Rather than further zooming in on each of our solutions, I would like to share some trends with us that are specific for the Benelux market. One of them is definitely the adoption of international standards. The Benelux governments realize that it's better to implement international standards than to start developing themselves. And one of the consequences of that is that the FHIR standards, the Fast Healthcare Interoperability Resources Standard, is quickly being adopted. It's a standard that is internationally used by hospitals, by healthcare providers, and by industry, and it's also used by the Belgian and Netherlands and Luxembourg governments for the exchange of messages between different healthcare providers. Of course, Comark, being an integration specialist, we adapt to that. We are developing solutions that are compliant with these international standards, and we are developing solutions, and I think that's very important, that fit into a bigger existing IT health ecosystem of an existing organization. Second trend is that there's a strong focus in the Benelux on mobile health. The governments are encouraging mobile health initiatives, some of which are reimbursed by the government. Worth mentioning here is the Belgian mHealth initiative. This is the pyramid you're seeing on screen. It's a system, or at least a framework that has gained international interest. The platform, which is a government platform, centralizes all relevant and required information on mobile apps by the industry for patients, healthcare providers, and healthcare institutions. It works in 3 levels, and the apps that in the end reach level 3 of the pyramid will get reimbursed by the government. A solution like our home health solution to monitor patients from home definitely has a place on this kind of platform, and we are already initiating the first discussions. In the Benelux, there are actually a lot of initiatives by private companies, non-profit organizations, and even by individual care providers. The government helps to identify these and streamline them for broader target groups. It's really a bit of a bottom-up approach rather than a top-down approach, and we already initiated the first talks with hospitals and care organizations to organize pilot projects that on a later stage can be rolled out on the bigger scale if they have proven to be successful. A last trend in the Benelux, and probably a bit everywhere in the world, is that the patient is increasingly put in the driver's seat. The idea is that the patient oneself will participate in the medical exchange. And in the case of a referral, for example, it will be the patient that can decide for oneself which healthcare provider he or she goes to. It's certainly a new evolution in the Benelux, and in concrete terms, we are moving towards a much larger exchange of prescriptions between individual healthcare providers and paramedics, not only between specialists and GPs, but also between care teams for example, the chronically ill patients. The patient himself will be able to play an active role in this exchange. And Comark is actively playing into that trend with, for example, our Health Note app. Our Health Note app is some kind of digital health diary that allows the patient to track his health and to easily share his medical data with the doctor. It engages the patient and it will amount to better treatment plan loyalty. That's from my side with regards to the Benelux. Thanks a lot for listening, and if you have more questions, please don't hesitate to reach out. Thank you.
Hi, my name is Bart, and I'm a BDM for Comark's Japanese operations, and I'd like to say a few words about the specifics of the Japanese market. It's already a cliché to say that Japan's healthcare system is one of the world's finest. Please have a look at this overall efficiency in all WHO member states. Japan is number 10 country, but still is very, very high. In fact, Japanese citizens have a longer life expectancy than anyone else on the planet. The system puts a high priority on preventative care and offers free screening tests for certain illnesses, as well as superb prenatal programs. Still, it is faced with challenges that can throw it into the abyss of despair if not addressed in a timely manner. Here are some of them. Now, this is the map of Japan, needless to say, right? Japan is an archipelago of 6,852 islands, some thousands of kilometers away from the main agglomerations. There are a few hundred distant islands without any doctors or dentists on them, leaving local inhabitants without any form of reasonably available care. The problem is partially solved by hospital ships and emergency helicopters, but those are costly to operate and maintain. Also, they do not have the capacity to eliminate the problem completely. Japan is an alpine country with mountain chains covering up to 80% of forests, covering over 60% of its surface. A natural consequence of that is that without building expensive infrastructure, roads, tunnels, water and electricity supplying systems, etc., providing essential healthcare services is impossible. And then Japan's population curve. As you can see, it's aging and shrinking, and really fast. It results in more health insurance burden on young people and, more importantly, more elderly with their ailments to serve. One big issue persistent in recent years in Japan is a large number of the elderly living alone, completely unattended. Often, their deaths go unnoticed for days. And now, Japan's rural areas are getting depopulated. Once populated areas are experiencing the outflow of especially young people. So-called shutter towns are commonplace in Japanese countryside. The situation creates more need for the care and the healthcare services for the elderly due to younger members of the traditional multi-generational families being unable to help directly. And then the number of doctors is growing, but the growth pace is slowing down and not keeping up with the proliferation in the ranks of patients. According to the OECD Health Statistics Report from 2019, there have only been 2.4 practicing physicians per 1,000 people in Japan, compared with 6.1 in Greece and 4.3 in Germany. To make things worse, medical specialists tend to gather in large prestigious medical facilities in big cities, mostly in Tokyo, making specialist medical services virtually unavailable for patients in distant rural areas. And now let's have a look at other factors as well. Japan belongs to most industrialist countries in the world, with vast manufacturing base. As so many people work in close proximity, the spread of infectious diseases would be immediate unless the right precautions are taken. Japanese legal system regarding the introduction of medical devices to the market is horrendously complicated, while procedures are time-consuming. So, as Comark Healthcare, how can we help the Japanese system? The first Comark product that comes to mind is our diagnostic point. It's a solution enabling to the measurement of all basic health parameters like body temperature, weight, saturation, ECG, blood pressure, sugar level, etc., and their provision to healthcare units from a distance. It can also be used as a video conferencing tool between patients and doctors. Diagnostic points can be installed not only in communication hubs like stations, ports and airports, places of commerce like supermarkets, malls, department stores, office buildings, etc., but also in factories or elderly care centers. Placing them in distant rural areas where the doctors are hard to find could help them keep an eye on their distant patients. Needless to say, it could save the healthcare system a lot of money too, because the ships and helicopters that I mentioned before would be dispatched only when necessary. Also, as you can see, there's a portable version of the diagnostic point available. With that, teams of paramedics can visit patients who have trouble moving in even the most inaccessible areas like islands or mountains, so the healthcare units can make sure that no patient is left unattended. Now, a few words about Comark Life bracelet. That's another product of ours that comes to mind. Originally designed for the elderly, it's a solution that, among others, can locate a person by its GPS module, call a doctor or a family if something happens or detects a fall. Since it's equipped with a voice module, a patient can make a phone call to a doctor or his family in the case they felt unwell or were in an accident. As I mentioned before, aging population and elderly living alone are quite an issue in Japan. This solution can contribute to well-being of the Japanese elderly, but not only. Also, when repurposed as quarantine warden, that's also one of the variations of this solution, the wristband can monitor the position of persons placed under compulsory quarantine. In the case when the wearer leaves the location where they are allowed to stay, the appropriate authorities will be alerted. And here is another of our solutions that could prove useful in the Japanese market. It's called cardio vest. Heart disease is the most frequent condition in older adults and the #1 cause of death. Heart failure, coronary artery disease, the atrial fibrillation are common reasons for health visits in hospital stays. With cardio vests on their chest, the elderly's ECG can be monitored in real time if needed, and in the case irregularities were detected, appropriate countermeasures can be applied. In Japan, population is shrinking. It experiences an acute lack of an array of qualified workers to keep its economy going. One of them is truck and bus drivers. Japanese don't seem to be losing their appetite for travel or the consumption of goods brought from afar. On the other hand, transport companies are struggling to find drivers to meet that demand and often make their drivers work long hours or employing elderly, which has occasionally been resulting in accidents. Comax cardio vest can reduce this problem by monitoring the driver's heart condition and detecting anomalies. If detected, such drivers would be not allowed to drive, or at least not to an extent to pose a threat to their own health and those of their passengers, of course. Finally, let me add to that all of the aforementioned solutions are connected to our e-care platform. All data are analyzed by the algorithms developed in cooperation with our medical specialists. If an anomaly is detected, a paramedic takes over and decides on the further course of action based on the circumstances. All the data system gathered can be stored and be a part of each citizen's lifelong health record. Thank you very much for listening, and I hope that you found it any useful. Thank you again.